Welcome to the deep dive. You've sent us some really interesting material focusing on the fear of flying, and that's exactly what we're going to explore today.
Great topic.
Yeah, our mission here is to really get a handle on this specific phobia
Yeah.
using, your sources as our guide.
Absolutely. And one of the first things that kind of jumps out is just the sheer number of names for it.
Right.
You've got fear of flying, obviously, flying anxiety, aviophobia, aerophobia, even phobia.
Wow, that's a mouthful.
It is, but I think it shows that it's more than just not liking turbulence. It's a real significant fear of actually being in a plane while it's flying.
Exactly. And the sources you sent, they covered a lot of ground. We're talking the symptoms, potential causes, how it's diagnosed, and really importantly, how people manage it.
Yeah, and there's some interesting history in there too, and maybe a few surprising bits.
Definitely. I saw something about like 9/11 and driving fatalities
Yeah.
and some famous people who've dealt with it. Should be some aha moments. Okay, so let's dive in. What does this fear actually look like? What does it feel like for someone?
Well, the materials describe it as this really intense, persistent fear or anxiety. And it's not just during the flight.
Okay.
No, it can happen even just thinking about flying. It's not just, mild nerves. It's serious enough that people might actively avoid flying altogether.
Right, avoiding it completely.
Exactly. And that avoidance, plus the fear itself, can cause real distress and, frankly, mess up their daily lives.
So it really limits people's options, their world in a way.
Precisely. Your sources mention common triggers like takeoff. That feeling of leaving the ground seems key for many. And bad weather, turbulence, those are maybe more obvious ones.
Sure, understandable.
But for some people, it's much more extreme. Like even just seeing a plane or hearing people talk about flying, that can be enough to trigger a panic attack. Or even, feeling physically sick.
Wow, just the thought of it.
Yeah. And here's something interesting apparently. Around 60% of people with this fear also report having some other anxiety disorder.
60%? That's high.
It is. It suggests that maybe fear of flying isn't always just this isolated thing. Sometimes it could be highlighting anxiety that's already there.
Like a symptom magnifier
Yeah.
almost. So does that mean figuring out the root cause is tricky? What are the potential roots, according to the sources?
That's a really good question. And the sources, at least the ones from around 2016, they indicate it wasn't actually fully understood back then. What seems clear is that it's probably not one single thing for everyone. It's quite heterogeneous is the term used. It shows up differently.
So different triggers, different underlying issues, maybe.
Possibly. One thing mentioned is a link to claustrophobia, the fear of enclosed spaces.
Right, being stuck in that middle tube.
Exactly. That feeling of confinement in the cabin can definitely be a factor for some. But interestingly,
Yeah,
while you might think the biggest fear is, the plane crashing,
that would seem logical.
it would. But the sources suggest that while it's obviously a concern, it's maybe less likely to be the main driver of the phobia itself.
Huh. That is surprising. Why would that be?
Well, it might be more about the immediate experience. The feeling of being entrapped, the lack of control right now, the sensations of flying. That immediate stuff seems to generate more constant anxiety for many, perhaps more than the abstract fear of a crash.
Okay, that makes a kind of sense. The present danger versus a potential future one.
Something like that. And it is officially classified, in the DSM-5, the big diagnostic manual, it's listed as a specific phobia.
So it's a recognized clinical condition.
Definitely. But diagnosing it isn't always straightforward. The materials explain that it can be hard to tell if the fear of flying is the main problem or if it's actually a symptom of something else. Like generalized anxiety disorder or maybe agoraphobia, that fear of situations you can't easily escape from, or as we said, claustrophobia.
So untangling whether flying is the fear or just where another fear shows up.
Exactly. It's like trying to figure out which thread starts the knot.
Okay, so if we understand a bit about what might be behind it, what do the sources say about actually managing it? Are there effective treatments?
Yes, definitely. The sources outline a few approaches. For immediate acute anxiety right before or during a flight, anti-anxiety medication can sometimes be used.
Okay, for short-term relief.
Right. But for longer-term change, exposure therapy is mentioned as a key treatment.
Facing the fear, basically.
Pretty much. And the research suggests it works even better when it's combined with cognitive behavioral therapy, CBT.
Ah, CBT. So that tackles the thought patterns.
Exactly. It makes sense, right? You address the anxious physical reactions through exposure, and you work on the thoughts and beliefs that are feeding the fear.
A two-pronged attack. Makes sense.
Yeah. And alongside those main therapies, things like relaxation techniques or even just learning more about how safe flying actually is can be helpful additions.
Education is a tool.
Right. But there's also something newer mentioned, which sounds quite interesting: virtual reality exposure therapy, VRET.
Oh, yeah. Virtual reality. How does that work for fear of flying?
Well, essentially, it uses computer tech to simulate the whole flying experience.
Like a very realistic flight simulator?
Kinda, yeah. You get the visuals being in the airport, on the plane, you get the sounds, maybe even some motion cues to make it feel more real.
Wow. So you're basically flying without actually leaving the ground. What's the advantage of that over, say, just taking short, real flights?
Good question. The sources list several advantages. First off, there's no actual risk, which can make it feel safer to start with.
Less intimidating, sure.
And crucially, the person can stop the simulation anytime they feel overwhelmed. That sense of control is huge.
I bet.
Plus, from a practical standpoint, VRT can be cheaper, easier to access, maybe less time-consuming, and definitely less hassle than organizing actual flights for therapy.
Yeah, you avoid all the airport logistics.
Totally. And another big plus is you can really zero in on the specific part of flying that causes the most anxiety.
Like takeoff.
Exactly. If takeoff is the trigger, you can practice virtual takeoffs over and over again, which you just can't do on a real flight.
That's clever. Does it work?
Well, the sources mentioned anxiety reduction rates around 80% for interventions like CBT, which is pretty significant.
80% reduction is huge.
It is, though it's also noted that completely eliminating the fear isn't always guaranteed across the board for all treatments. But VRET seems like a really promising way to tackle it in a controlled, step-by-step way.
Okay, so real progress is possible, even if zero fear isn't always the end goal. Let's shift gears a bit. How common is this? And is it a new thing tied to modern travel?
The prevalence and history. Yeah, this is interesting. The numbers for how many people have it, they're kind of all over the place.
Really? Like how wide a range?
Your sources suggest anywhere from about 2.5% up to maybe 40%.
40%, that's a massive difference. Why so very?
It probably comes down to how it's measured. The lower numbers, like 2.5%, they likely come from studies where people got a formal diagnosis from a professional.
Okay, clinical diagnosis.
Right. The higher end, up near 40%.
Yeah.
That probably includes people who just self-report having a fear of flying, whether it's clinically significant or not.
Self-diagnosis captures a much wider net. Makes sense.
Exactly. And historically, it's not brand new. The first time it really appears in medical writings was actually after World War I.
World War I, wow.
Yeah, a doctor in the UK wrote about it. He called it aeroneurosis, and he was talking specifically about pilots and aircrew.
So linked right back to the early days of flight and the stress on the flyers themselves.
Seems so. Tied to the very beginnings of aviation.
Fascinating.
And here's that surprising statistic you mentioned earlier. After the September 11th attacks,
Yeah.
understandably, fewer people wanted to fly. Many more people chose to drive instead.
Right.
But tragically, estimates suggest that increase in road traffic led to about 350 more road deaths than usual in the following year.
Wow. That's sobering. An unintended consequence of that collective fear.
It really shows how fear can ripple outwards and affect behavior, sometimes in unexpected and tragic ways.
Definitely. The sources also mentioned some famous names.
They did. Dennis Bergkamp, the footballer, they called him the non-flying Dutchman.
I remember that.
Yeah, Agnetha Feltskog from ABA, apparently.
Oh.
Travis Barker, the drummer, who actually survived a plane crash.
No. Wow. Understandable then.
Absolutely. And sadly, Richie Valens, the rock and roll singer who died in that famous plane crash. Even David Bowie was reported to have a fear of flying.
It really drives home that it can affect anyone, doesn't it?
Absolutely. Fame or success offers no immunity.
So finally then, what about the state of the research itself? Back in 2016, how well was this being studied?
Well, according to your materials, while everyone knew fear of flying was a thing, the actual why, the deep psychological mechanisms keeping the fear going, wasn't super well researched at that point.
Still some mystery there.
Yeah. There had been studies looking at things like illusory correlation. That's like mistakenly linking flying with danger, even if statistically it's safe.
Okay.
And expectancy bias, basically, expecting something bad to happen on a flight. But these hadn't really led to clear, conclusive answers on the core mechanisms.
So complex to pin down.
Very. And the sources also point out a real practical challenge in researching treatments for this kind of thing.
What's that?
It's just really hard to do good placebo or control groups for behavioral therapies. You can't easily fake exposure therapy or CBT like you can test a sugar pill against a real drug.
Right, you can't give someone placebo therapy.
Exactly. So that makes it tougher to definitively prove how well different approaches work compared to just, say, the passage of time or the effect of attention.
Okay, that methodological challenge makes sense. So as we wrap up this deep dive, what are the main things we should take away about fear of flying based on these sources?
I think the big picture is fear of flying is a legitimate, often intense phobia. It's definitely more than just not liking planes. It seems to have various possible roots, shows up differently in different people. And while it's clearly challenging for those experiencing it, there are effective ways to manage it. Things like CBT and exposure therapy show real promise.
And the VR8, the virtual reality.
Yeah, and VRA offers this newer, potentially more accessible and controlled way to tackle it. So understanding all these facets, the psychology, the history, even the societal impact, like the post-9/11 driving stats, gives us a much richer picture of anxiety and how we deal with it.
It really does. And maybe a final thought for you, our listener, to mull over. Thinking about that virtual reality tech,
Yeah.
how might advancements there change how we understand and treat other anxiety disorders in the future?
That's a great question. The potential seems huge.
Definitely something to think about. Well, thanks for joining us for this deep dive. We hope it's giving you some new insights into the fear of flying.